Have you ever looked at your blood pressure reading and thought, well, the top number looks fine, so I must be healthy? Many people do. But what if I told you that the bottom number, the one most people ignore, could be silently warning you about something dangerous? That bottom number is your diastolic blood pressure, and it plays a role far more important than most people realize. Ignoring it could put your heart, your brain, and even your life at risk. Today, we are going to explore the hidden truth about low diastolic blood pressure, the symptoms you should never overlook, what science reveals about its dangers, and how you can protect yourself before it's too late. Let's begin with the basics, because understanding is the first step toward action. Blood pressure has two numbers. The top, called systolic, measures the force of blood against artery walls when your heart beats. The bottom, called diastolic, measures the pressure when your heart rests between beats. Doctors generally consider a normal diastolic reading to be between 60 and 80 millimeters of mercury, or mmHg. When that bottom number consistently drops below 60, you have what's known as low diastolic blood pressure. And while a high top number often gets the spotlight, studies show that a low bottom number can be equally harmful, sometimes even more. Research from the Journal of the American College of Cardiology highlights that low diastolic readings, especially under 60, are linked to a higher risk of heart disease and even premature death. Why? Because diastolic pressure is responsible for supplying your coronary arteries, the blood vessels that feed your heart muscle, with oxygen-rich blood. If the diastolic pressure falls too low, your heart literally doesn't get the nourishment it needs when it's resting between beats. Think about that for a moment. Your heart works tirelessly, pumping day and night, and it depends on those brief moments of rest between beats to recover. That's when it refuels itself with oxygen and nutrients. But when diastolic pressure drops too low, that refueling is cut short. Instead of being bathed in life-giving oxygen, your heart muscle is starved. Over time, this starved state can trigger a cascade of problems, from angina and arrhythmias to heart failure and even heart attacks. That's why ignoring low diastolic blood pressure is like ignoring a warning light on your car dashboard. You might keep driving for a while, but the damage is already building silently under the hood. The problem is that low diastolic blood pressure doesn't always scream for attention. Often, it whispers. The symptoms can be so vague that people brush them aside. But your body is clever, and it always tries to send warning signals. The first and most common signs are dizziness, lightheadedness, and fainting spells. These occur because your brain isn't getting enough oxygen. Imagine standing up quickly and feeling like the world spins for a few seconds. Now imagine that happening more often and sometimes so intensely that you collapse. It's not just inconvenient. It can be dangerous if it happens while driving, walking downstairs, or even just crossing the street. Other symptoms are more subtle but equally concerning. Fatigue, blurred vision, chest discomfort, and shortness of breath. You might feel like you're constantly tired even after sleeping well. Or you may notice that your vision seems cloudy at times, especially when standing up or exerting yourself. These aren't random annoyances. They're signs that your organs aren't receiving the steady supply of oxygen they need. A study published in Hypotension journal found that patients with low diastolic pressure frequently reported problems with concentration and memory. Why? Because just like the heart, the brain relies on consistent blood flow to function at its peak. When that flow weakens, your ability to think, remember, and focus declines. This isn't just about being forgetful. It's about brain health and the risk of long-term damage. So what causes low diastolic blood pressure in the first place? The answer is complex, and it varies depending on age and health conditions. In older adults, one of the biggest culprits is arterial stiffness. As we age, our arteries naturally lose flexibility. They can't expand and contract as easily, so they fail to maintain proper pressure when the heart rests. This can cause systolic pressure to rise while diastolic falls, creating a dangerous imbalance. In younger adults, the causes are different. Dehydration is a surprisingly common trigger, because when you don't have enough fluid in your body, your blood volume decreases and pressure drops. Thyroid disorders, adrenal issues, infections, and even severe allergic reactions can all push diastolic numbers downward. But one of the most overlooked causes is medication. Many people being treated for high blood pressure take medications like diuretics, ACE inhibitors, or beta blockers. These drugs can sometimes push diastolic pressure too low, especially if the dose is too strong or if the body reacts sensitively. Scientific research confirms that this isn't a small issue. A large study published in the New England Journal of Medicine revealed that individuals with diastolic readings consistently below 60 faced significantly higher risks of heart failure, even when their systolic pressure was normal. This means it's not enough to simply say, "My top number looks good, so I'm safe." Both numbers matter, and balance is key. Now let's go deeper into the specific symptoms you should never ignore if you suspect low diastolic blood pressure. The first is dizziness and fainting, which we've already touched on. These episodes indicate your brain is starving for oxygen. Don't just chalk it up to standing too fast. Pay attention if it happens frequently. The second symptom is chest pain or discomfort. This is particularly alarming because it suggests that your heart muscle itself is not receiving enough oxygen. We often associate chest pain with high blood pressure, but low diastolic pressure can also cause angina-like symptoms. Third, there's shortness of breath, especially during activities like walking, climbing stairs, or even talking. If your diastolic pressure is too low, your heart struggles to pump enough oxygen-rich blood when demand increases, leaving you breathless. Fourth, watch for confusion, poor focus, or memory lapses. Studies from the American Heart Association indicate that long-term low diastolic pressure may increase the risk of cognitive decline and even dementia. And finally, don't ignore cold hands and feet or unusually pale skin. When your circulation weakens, your extremities are the first to show it. These physical changes are your body's way of raising a red flag. At this point, you may be asking, what should I do if I notice these symptoms? The first step is identification. Don't wait until a fainting episode lands you in the emergency room. Check your blood pressure regularly at home. Affordable monitors are available, and they can give you valuable data. If your diastolic number consistently falls below 60, take it seriously. Document your readings and share them with your doctor. The second step is to understand and address the causes. If medications are at fault, your doctor may need to adjust the dosage or switch you to a different prescription. If dehydration is the problem, increasing your water and electrolyte intake can help. If thyroid or adrenal issues are suspected, medical testing and treatment are necessary. But beyond medical causes, lifestyle plays a huge role. Research shows that small daily habits can influence blood pressure significantly. Staying hydrated is the simplest yet most effective strategy. Aim for at least 6 to 8 glasses of water a day, and more if you live in hot climates or exercise regularly. Nutrition also matters. Too little sodium can sometimes lower blood pressure too far, especially if combined with heavy sweating or certain medications. A balanced diet that includes potassium-rich foods like bananas, spinach, and avocados, along with adequate salt intake, helps maintain pressure. Exercise is another powerful tool. Moderate, consistent activity like walking or light cycling improves vascular elasticity and heart efficiency. According to a study in Circulation Research, even 30 minutes of walking a day helped older adults maintain healthier diastolic pressure. Stress management is equally important. Chronic stress throws your nervous system into chaos, leading to unpredictable blood pressure swings. Practicing relaxation techniques, deep breathing, or mindfulness can stabilize both systolic and diastolic numbers. Now, you might be wondering, is low diastolic blood pressure always dangerous? Well, the answer is no. Some people naturally have slightly lower diastolic readings without any health consequences. The problem really arises when it falls too low for your body's needs, or when it's tied to underlying conditions like arterial stiffness or, medication side effects. That's why context matters. A healthy young adult with a diastolic of 58 might be perfectly fine, while an older adult with a diastolic of 55 and chest discomfort could be in real danger. The key is not to ignore the numbers, but to interpret them in relation to your overall health and symptoms. Now that you understand what low diastolic blood pressure is, why it happens, and what symptoms you should never ignore, the next step is even more important. What can you actually do about it? Awareness without action doesn't change your health. But the good news is that science gives us clear, practical steps to protect yourself, strengthen your heart, and keep your diastolic pressure within a safer range. In this part of the video, we'll go deeper into prevention, lifestyle strategies, medical insights, and red flags that demand urgent attention. By the end, you'll have the knowledge to take control of your health and reduce your risks. The first and most powerful tool is regular monitoring. You cannot manage what you don't measure. Blood pressure isn't static. It changes throughout the day depending on activity, stress, hydration, and even meals. That's why experts recommend that anyone over 50, and especially those with heart disease, diabetes, or kidney issues, should check their blood pressure several times a week. A home blood pressure monitor is not just a gadget. It's a life-saving tool. But here's the key. You have to use it properly. Sit calmly for 5 minutes before measuring. Place the cuff on bare skin at the level of your heart. Take 2 to 3 readings at the same time each day, and keep a log. This log will help you and your doctor spot patterns, like diastolic numbers dipping too low in the morning, after medication, or following meals. Studies published in the Journal of Hypertension confirm that consistent home monitoring leads to better outcomes than relying only on occasional doctor's office readings. The second major factor is hydration. It sounds simple, but dehydration is one of the most underestimated causes of low diastolic pressure. Your blood is composed of about 50% water, and when fluid levels drop, so does blood volume. Less volume means weaker pressure, especially during the heart's resting phase. Drinking 6 to 8 glasses of water daily is the minimum, and you may need more if you're physically active or live in hot climates. But hydration is not just about plain water. Electrolytes like sodium, potassium, and magnesium also matter. If you only drink water without replacing electrolytes, you may not see improvement. That's why natural sources like coconut water, bananas, leafy greens, and nuts can play a crucial role. Research in the European Journal of Clinical Nutrition showed that mild dehydration alone can lower diastolic readings significantly, especially in older adults. Now, let's move to nutrition, because food choices directly impact blood pressure. People with low diastolic readings often make the mistake of cutting sodium too aggressively, especially if they've been told to lower their blood pressure in the past. While reducing excess salt is good for many, having too little sodium can push diastolic numbers dangerously low. Sodium helps maintain blood volume, which is essential for healthy pressure. That doesn't mean you should load up on salty processed foods, but a balanced intake from natural sources like sea salt, olives, or lightly salted vegetables can make a big difference. Potassium, on the other hand, helps regulate the balance of fluids and keeps the heart beating steadily. Foods rich in potassium include bananas, sweet potatoes, spinach, and beans. Magnesium is another key mineral, as it relaxes blood vessels and supports circulation. Almonds, cashews, and whole grains are great sources. The message here is balance, not extremes. A diet rich in whole foods, vegetables, lean proteins, and healthy fats provides the nutrients your cardiovascular system needs to function optimally. Another powerful tool is exercise. You might think that exercising would lower blood pressure even more, but science says otherwise when it comes to diastolic health. Regular, moderate physical activity strengthens the heart and improves the elasticity of blood vessels. This means that when your heart relaxes, the vessels can maintain better pressure. The trick is moderation. Extreme workouts or sudden bursts of activity can cause dangerous drops, but steady activities like brisk walking, cycling, or swimming for 30 minutes a day are highly beneficial. A study in circulation research found that older adults who engaged in daily walking significantly improved their diastolic function, lowering their risk of heart failure. Movement is medicine, and in this case, it keeps that critical bottom number more stable. Stress management is another area you cannot ignore. Stress activates your sympathetic nervous system, the fight or flight response, which can cause wild swings in blood pressure. While short bursts of stress may temporarily raise both systolic and diastolic numbers, chronic stress can weaken your cardiovascular system, making it harder to regulate pressure consistently. Practices like meditation, deep breathing exercises, yoga, or even simple hobbies that relax you are not just good for your mind. They directly protect your heart. Data from the American Journal of Hypertension shows that people who practiced regular stress reduction techniques had more stable blood pressure readings, reducing the risk of both high spikes and dangerously low dips. Of course, sometimes lifestyle alone isn't enough, and this brings us to medications. Many cases of low diastolic blood pressure are actually caused by drugs prescribed to treat high blood pressure. Medications like diuretics, ACE inhibitors, or beta blockers are designed to reduce systolic pressure, but in some people they overshoot, pushing the diastolic too low. If you notice dizziness, fainting, or fatigue after starting or adjusting medication, don't ignore it. But also, don't stop your medication without consulting your doctor. The right approach is to discuss your symptoms with your healthcare provider, who may adjust the dose, change the timing, or switch you to a different class of drug. The goal is balance, not eliminating treatment, but tailoring it so that both systolic and diastolic remain in a safe range. For seniors, the challenge is even greater. As arteries stiffen with age, a condition known as isolated systolic hypertension often appears. This is when the top number rises while the bottom number falls. Research from the famous Framingham Heart Study showed that this pattern is strongly linked to heart attacks and strokes. That means older adults cannot afford to dismiss low diastolic numbers as normal aging. It requires active management through diet, exercise, medications if needed, and close monitoring. So, what should you do in a moment of crisis? When your diastolic number drops suddenly, or you experience severe symptoms? Here are the immediate steps. First, sit or lie down to prevent falls or injuries. Second, drink water, preferably with electrolytes, to quickly restore blood volume. Third, check your blood pressure again after 5 to 10 minutes. If it remains dangerously low, or if you experience chest pain, severe shortness of breath, or fainting, seek emergency care immediately. These are not symptoms to wait out. They are urgent signs that your heart or brain may not be receiving enough oxygen. Prevention, of course, is always better than emergency response. And small daily habits are your strongest shield. Eat balanced meals instead of skipping them, because sudden drops in blood sugar can worsen low blood pressure. Avoid standing up too quickly, as orthostatic hypotension, those sudden drops when standing, is common among folks with low diastolic numbers. Limit alcohol, because it dilates blood vessels and lowers pressure even further. Prioritize quality sleep, since poor rest disrupts the hormonal systems that regulate blood pressure. These may sound like small lifestyle tweaks, but combined, they create a powerful defense against low diastolic complications. The question many people ask is, when should I be worried enough to see a doctor? Here are the red flags you must never ignore. If your diastolic consistently reads below 50 millimeters of mercury, that is a serious concern. If you experience frequent fainting spells, severe dizziness, chest pain, or pressure, you need medical attention. If you notice sudden confusion, vision problems, or difficulty speaking, it could be a sign that your brain is not receiving enough blood, and you must call emergency services. Shortness of breath at rest or with minimal activity is another warning that your heart is under strain. These are not minor issues. They are your body's way of pleading with you to act. Let's step back and look at the bigger picture. Low diastolic blood pressure is not just a number on a machine. It is a reflection of how well your heart and blood vessels are supporting your most vital organs. Too low, and the risk is silent damage that builds over time. Too high, and the risk is strain and rupture. Health lies in the balance. The most important thing you can do is to be proactive. Monitor your numbers, stay hydrated, nourish your body with the right foods, move regularly, manage stress, and consult your doctor when needed. Science makes one thing clear. Ignoring diastolic blood pressure is a mistake. While systolic numbers grab attention, diastolic is the quiet guardian of your heart's recovery. Protect it, and you protect your future. So now that you know the symptoms you should never ignore, the causes behind low diastolic blood pressure, and the practical steps you can take every day, the responsibility is in your hands. Knowledge is power, but only if you act on it. Don't let this information slip away. Use it to safeguard your health and the health of those you love. And before we close, I have one last request. If this video gave you clarity and opened your eyes to the dangers of ignoring your diastolic blood pressure, please hit the like button, subscribe to our channel, and share this video with your friends and family. Because you never know, this simple knowledge could save someone's life.